Welcome to J Healthy Lifestyle. Today we're diving deep into autism spectrum disorder, or ASD. Autism is a complex neurological condition that affects how people communicate, interact, and learn. It's a spectrum, meaning it manifests differently in every individual. But now, a new wave of research offers a glimmer of hope: stem cell therapy. Autism is a spectrum of disorders with a wide range of symptoms and severity. Scientists believe that a combination of genetic and environmental factors contributes to its development. Studies have shown that individuals with ASD often exhibit higher levels of inflammation in specific brain regions. This inflammation may disrupt normal brain development and contribute to the core symptoms of autism. Stem cell therapy has emerged as a potential game changer in regenerative medicine. Stem cells can develop into different types of cells, including brain cells. In autism, stem cell therapy aims to modulate the immune system and reduce brain inflammation. This approach offers hope for long-term improvements in the lives of individuals with ASD. Stem cells are the body's raw materials, capable of developing into various cell types. Their ability to divide and renew makes them intriguing for treating conditions like autism. Two types of stem cells are used in autism treatment: umbilical cord blood-derived and bone marrow-derived. These adult stem cells play a crucial role in tissue repair and regeneration. Stem cells can transform into various cell types, offering potential for repairing damaged tissues. Umbilical cord blood and bone marrow are primary sources for treating autism. Umbilical cord blood contains hematopoietic stem cells, adept at modulating the immune system. Bone marrow contains mesenchymal stem cells, capable of promoting tissue repair and reducing inflammation. Umbilical cord blood stem cells offer hope for treating conditions like autism. These cells can modulate the immune system and reduce brain inflammation. They are readily available and can be collected non-invasively at birth. Early studies suggest these cells hold promise for improving communication and social interaction in ASD. Bone marrow contains mesenchymal stem cells, versatile in transforming into different cell types. MSCs can repair and regenerate damaged tissues, offering hope for autism treatment. They can dampen brain inflammation and promote neuronal growth. MSCs may help improve communication and social interaction skills in individuals with autism. Inflammation in the brain is linked to the development of autism. This inflammation can disrupt neural connections and neurotransmitter balance. The inflammatory hypothesis shifts focus to therapies addressing neurological inflammation. Stem cells, with their ability to modulate the immune system, offer potential as a game changer. Stem cells can combat inflammation and restore balance to the brain. They secrete anti-inflammatory molecules, calming overactive immune cells. Stem cells can also repair damage by stimulating new blood vessel production. This multi-pronged approach makes stem cells promising for treating autism. Stem cells, especially mesenchymal stem cells, can participate in neural repair. MSCs can differentiate into neurons and glial cells, promoting neural growth. They stimulate neurotrophic factors essential for synapse formation and strengthening. This ability to repair and reduce inflammation makes stem cells a unique therapeutic approach for autism. The potential of stem cells to repair neural connections in the autistic brain taps into neuroplasticity, the brain's ability to change and adapt. Groundbreaking research reveals the brain is dynamic, constantly rewiring itself. In the autistic brain, pathways may be underdeveloped or misdirected, leading to communication challenges. Stem cells offer hope by nurturing pathways, clearing overgrowth, and forging new connections. This approach primes the brain for change, paving the way for improved learning and communication. Embarking on the path of stem cell therapy for autism, is a significant decision, often accompanied by a mix of hope, anticipation, and perhaps a touch of apprehension. Like any medical journey, understanding the process can empower families to make informed choices and navigate each step with greater confidence. The first step involves a thorough evaluation by a qualified medical professional specializing in stem cell therapy for autism. This initial consultation serves as a crucial starting point, allowing the medical team to assess the individual's specific needs, medical history, and suitability for treatment. During this consultation, the medical team will typically conduct a comprehensive assessment, which may include reviewing medical records, conducting physical examinations, and potentially ordering additional tests to evaluate the individual's overall health and the severity of their autism symptoms. This thorough evaluation helps to determine whether stem cell therapy is a viable option, and if so, to tailor a personalized treatment plan. Once the initial assessment is complete, the medical team will discuss the potential benefits, risks, and limitations of stem cell therapy with the family. This open and honest dialogue is essential for ensuring that families have realistic expectations and are fully informed about the procedure, recovery process, and potential outcomes. Armed with this knowledge, families can then make an informed decision about whether to proceed with stem cell therapy, knowing that they have carefully considered all aspects of this innovative treatment approach. With the decision made to embark on the stem cell therapy journey, the next step involves obtaining the precious stem cells that hold the potential to transform lives. As we've discussed, the two primary sources of stem cells for autism treatment are umbilical cord blood and bone marrow, each with its own unique set of considerations for collection and processing. For families who had the foresight to bank their child's umbilical cord blood at birth, accessing these stored stem cells is a relatively straightforward process. Cord blood banks maintain these life-saving cells in cryopreservation, frozen in time and ready to be thawed and utilized when needed. If umbilical cord blood banking wasn't an option, bone marrow becomes the primary source for stem cell harvesting. The procedure for obtaining bone marrow-derived stem cells is minimally invasive, typically performed under sedation or anesthesia to ensure the individual's comfort. During a bone marrow aspiration, a specialized needle is inserted into the hip bone, specifically targeting the iliac crest, a region rich in bone marrow. The needle is used to extract a small amount of bone marrow, which contains the desired mesenchymal stem cells, MSCs. Once collected, whether from umbilical cord blood or bone marrow, the stem cells undergo a meticulous processing and purification process in a specialized laboratory. This crucial step ensures that the stem cells are isolated from other cell types and prepared for infusion back into the individual, ready to embark on their mission of healing and repair. Section 3. Delivering the potential, the stem cell infusion process. With the stem cells carefully harvested, processed, and prepared, the stage is set for the next crucial step, the stem cell infusion. The infusion is typically administered intravenously, similar to receiving an IV drip. This allows the stem cells to enter the bloodstream and circulate throughout the body. The infusion process is generally well tolerated, with minimal side effects. Once the infusion is complete, the stem cells get to work, modulating the immune system and reducing inflammation. Section 4. A personalized approach. Tailoring treatment to individual needs. Stem cell therapy for autism offers potential for personalization. Autism manifests differently in each individual, so treatment plans are tailored to unique needs. Comprehensive assessments determine specific symptom profiles and health status. Factors like age and severity of symptoms guide treatment plans. Dosage and frequency of infusions are adjusted individually. Some need a single infusion, others multiple over time. The medical team monitors progress and adjusts plans to optimize outcomes. Stem cell therapy can be integrated with other therapies. A personalized approach aims for meaningful improvements in quality of life. Section 1. Glimmers of hope. Promising results from early studies. As we stand on the frontier of stem cell therapy for autism, it's the early clinical trials and observational studies that provide the first glimpses of hope. While this innovative approach is still in its infancy, the initial findings offer compelling evidence to suggest that stem cells have the potential to make a real difference in the lives of individuals with ASD. Imagine a child who once struggled to make eye contact, now engaging in playful interactions with peers, or a teenager who previously found it difficult to express their needs, now using words to communicate their thoughts and feelings. These are just a few of the promising outcomes reported in early studies exploring the potential of stem cell therapy for autism. While the specific improvements vary from person to person, many studies have reported significant gains in core areas affected by autism, including social interaction, communication, and behavior. These early findings, while preliminary, provide a beacon of hope for families seeking therapies that can address the underlying neurological differences associated with ASD. It's important to note that stem cell therapy for autism is not a one-size-fits-all solution, and results can vary depending on factors such as the individual's age, the severity of their autism symptoms, and the type and dosage of stem cells used. However, the consistency of positive results across multiple studies suggests that stem cells hold immense potential for improving the quality of life for individuals with ASD and their families. Section 2, Social Interaction, Fostering Connections and Reducing Anxiety. Stem cell therapy is making a difference in social interaction for individuals with autism. Navigating social engagement can lead to anxiety and isolation. After therapy, children approach others with newfound confidence. Early studies show significant improvements in social skills. Therapy reduces anxiety, fostering friendships and a sense of belonging. Section 3. Communication. Unlocking the power of language and expression. Communication, the cornerstone of human connection, can be a significant challenge for individuals with autism. Many struggle to express themselves verbally, relying on nonverbal communication, such as gestures or sign language, to convey their needs and desires. Others may have limited speech, often repeating phrases or struggling to initiate or sustain conversations. Imagine the frustration of a child with autism, bursting with thoughts and ideas, yet unable to articulate them into words. Now, envision that same child, after undergoing stem cell therapy, stringing together sentences, engaging in back-and-forth conversations, and using language to connect with the world around them. Early studies exploring the impact of stem cell therapy on communication in individuals with ASD have yielded encouraging results. Some studies have reported improvements in both receptive language, the ability to understand spoken language, and expressive language, the ability to use language to communicate thoughts and ideas. Children who previously relied heavily on nonverbal communication have shown remarkable progress in developing verbal language skills, expanding their vocabulary, and using more complex sentence structures. Individuals with limited speech have demonstrated increased vocalizations, greater clarity in their speech, and a newfound ability to initiate and participate in conversations. While the exact mechanisms by which stem cells enhance communication are still being investigated, researchers believe that the cell's ability to reduce inflammation, promote neural repair, and enhance neuroplasticity may all play a role in unlocking the power of language and expression in individuals with ASD. Navigating a world of sensory overload. For many with autism, the world can feel chaotic, bombarding their senses with sights, sounds, smells, and textures. This sensory overload can lead to repetitive behaviors, meltdowns, and difficulty transitioning. Imagine a child overwhelmed by a grocery store experiencing a sensory meltdown. Now envision that same child after stem cell therapy, navigating with greater ease. Early studies suggest stem cell therapy may help address behavioral challenges in autism. Section 5. A future bright with potential, ongoing research, and long-term vision. Stem cell therapy for autism holds immense promise for transforming lives. Early results are encouraging, but more research is needed to unlock its full potential. Larger clinical trials and understanding mechanisms are crucial. The future of stem cell therapy for autism is bright with potential. A future where every individual with autism can live a full, meaningful life. Section 1. A new frontier in autism treatment. As we conclude our exploration of stem cell therapy for autism, it's evident that we stand on the edge of a new frontier in medicine. This innovative approach, still in its early stages, offers a beacon of hope for individuals with ASD and their families, a hope rooted in the potential to address the underlying neurological differences that contribute to this complex condition. While traditional therapies have focused primarily on managing symptoms, stem cell therapy represents a paradigm shift, aiming to modulate the immune system, reduce inflammation, and potentially even repair damaged neural connections in the brain. This multifaceted approach, combined with the brain's inherent capacity for change, known as neuroplasticity, offers a compelling vision for a future where individuals with ASD can experience greater well-being and reach their full potential. The early clinical trials and observational studies, while preliminary, provide encouraging glimpses of the transformative power of stem cells. From improvements in social interaction and communication to reductions in behavioral challenges, the initial findings suggest that stem cell therapy has the potential to make a real difference in the lives of individuals with ASD and their families. However, it's crucial to approach this emerging field with both cautious optimism and a commitment to ongoing research. Larger, more robust clinical trials with longer follow-up periods are essential to confirm the safety and efficacy of stem cell therapy for autism and to determine the optimal treatment protocols for different individuals. Section 2. Empowering Families, Embracing Hope. The journey of navigating autism is unique for every individual and family. It's a journey often marked by challenges, triumphs, and a constant search for answers and effective therapies. Stem cell therapy, while not a cure, offers a new avenue of hope, a potential path towards improved quality of life and greater well-being for those touched by ASD. As we move forward, it's essential that families feel empowered to make informed decisions about their health care, equipped with the knowledge to weigh the potential benefits and risks of stem cell therapy in consultation with qualified medical professionals. Open and honest dialogue between families and healthcare providers is crucial for setting realistic expectations, addressing concerns, and developing personalized treatment plans that align with individual needs and values. The future of stem cell therapy for autism is a shared journey, a collaborative effort involving scientists, clinicians, individuals with ASD, and their families. By working together, embracing hope, and remaining committed to advancing research and understanding, we can strive towards a future where every individual with autism has the opportunity to live a full, meaningful, and connected life. Thank you for joining us on this exploration of stem cell therapy for autism. If you found this information valuable, please give this video a thumbs up and subscribe to our channel for more insightful content on health and well-being. Remember, knowledge is power, and together we can make a difference.